Hello, everyone. My name is Grace Goodwin, and I'm presenting my poster entitled Changes in Cognitive Networks as a Result of Sport-Related Concussion. Thanks for stopping by. Neuropsychological assessment has been described as a cornerstone of sport-related concussion management and an important component of return-to-play decision-making. Athletes typically undergo baseline assessments at preseason and again after suspected concussion. Many athletic programs use immediate post-concussion assessment and cognitive testing, or IMPACT, to track symptom severity and cognitive disruption following concussion. IMPACT generates a total symptom score and 5 cognitive composite scores that represent different domains of functioning. An athlete's baseline and post-concussion scores are compared, and declines in scores following injury point to concussion-related difficulties. This method of comparing composite scores fits under a common cause framework, which assumes that association among observed variables can be accounted for by a single common entity. While this interpretive approach, of course, has its advantages, common cause frameworks fail to acknowledge that cognitive functions work in close interdependent concert and rarely operate in isolation. Network models address issues inherent in common cause models because network models assume that cognitive performance is a byproduct of the dynamic interactions between different cognitive processes. Network analysis allows for the graphical representation of observed elements, which are called nodes, and the statistical relationship among them, or edges. It's also possible to identify central or influential nodes within a network. Similar to how certain people within a social network are important for the facilitation of relationships, certain cognitive nodes may be more central or essential for network maintenance. Network analysis has the potential to characterize cognitive functioning, for example, at a more granular level, while considering the interconnectedness and mutual facilitation of cognitive abilities. This could provide novel information about cognitive recovery post-concussion, and it can identify target areas for neurocognitive rehabilitation that are more attuned to personalized medicine. So my study used network analysis to longitudinally examine the topology of cognitive abilities following sport-related concussion. Each participant in the study had 3 assessment time points, once before the start of the season, then again within 72 hours of suspected concussion, and then again before they were cleared to return to play. Networks were estimated using individual scores from IMPACT cognitive subtests at each time point. I calculated 4 measures of centrality: strength, closeness, betweenness, and expected influence. And I compared the 3 networks' connectivity and structure to determine whether networks changed within athlete over time as a result of concussion. Finally, I ran a repeated measures ANOVA to see whether composite scores changed over time. All 3 network structures were accurate, stable, and interpretable. Only node strength and expected influence were stable in each network. All 3 networks consisted of both positive and negative edges. Nodes that were high in strength centrality are highlighted yellow, and nodes high in expected influence are highlighted green in each of the network figures. X's and O's interference task scores were high in strength centrality, while design memory scores and color match reaction time for commission errors had highest expected influence. This means that those nodes had high cumulative influence within their respective networks and may affect the activation, persistence, and remission of the network. Network connectivity significantly increased from time 1 to time 2 and remained hyperconnected at time 3. There was also a significant difference in network structure from time 1 to time 3. Finally, repeated measures ANOVA revealed a pattern in which composite scores significantly worsened from time 1 to time 2 and significantly improved at time 3, as you can see in the figure on the right. The 2 analysis approaches revealed potentially disparate conclusions regarding sport-related concussion recovery. IMPACT composite scores followed the typical recovery pattern. Meanwhile, the networks tell a different story. The time 3 network exhibited significantly increased connectivity compared to time 1, a pattern that emerged between time 1 and time 2, suggesting that the 2 weeks post-injury network remained more similar to the acute post-injury network than the pre-injury network. Interestingly, functional brain networks also become hyperconnected post-concussion, possibly reflecting recruitment of additional resources to enable communication and compensate for network disruption. Hyperconnectivity in cognitive networks could reflect a similar process, engagement of more resources to meet task demands as a result of underlying disruption. Processing speed, visual memory, and impulsivity nodes influenced performance on other cognitive measures. Treatments designed to reduce difficulties in these domains may reduce cognitive difficulties overall, thereby promoting quicker recovery. In sum, a network perspective may improve treatment and clinical decision-making, thereby providing an effective means of preventing or mitigating persisting cognitive difficulties after concussion. Thank you.